Hi, I'm Dr. John Nosti, and many people ask me, what is the best way to go through the Ultimate Occlusion Series? You know, there really is no right or wrong. And me, I am definitely a CE junkie, and I want all the information as fast as possible. So for me, I'm going to definitely go through U01 and up to U04, but at some point in time, I'm going to pepper in the Anterior Aesthetics course and the full mouth Over-the-Shoulder Reconstruction course. Why? Because those two courses are basically the live action. Let's see it from start to finish on a patient, on multiple patients, but let's see it actually be done with all the nuances that it's really hard to cover in the didactic information and didactic lectures. So the Anterior Aesthetics course, that's like the live version of U01. The Over-the-Shoulder Reconstruction course, that's like the live version of U02. So although there's no right or wrong, I like to take U01, I'd like to see Anterior Aesthetics live and see it happen, and then take U02, and then see the Over-the-Shoulder Reconstruction course and make it happen, and then go to U03 and U04. But if you want to do U01 or U04, there's no right or wrong to doing that, but then make sure you see the Anterior Aesthetics and Reconstruction course, whichever fits into your schedule, and do it as fast as possible. That's definitely my recommendation, because when you take those 6 courses and put it into a whole, there is no way that you're not going to be ready to rock the drill.